These are the 5 things you need to know about physicians. Number 1, money is not their only motivator. There's a stigma in the marketplace that physicians must be compensated for their time in order to participate in hospital activities. That's simply not true. Physicians are motivated by things like having a voice in the conversation, understanding how their voice made an impact, as well as understanding that their voice has been celebrated and appreciated by their peers and those folks around them. At the end of the day, physicians are people, and they ultimately care about their patients and providing the best patient care possible. So remember, focus on the people and not the stigma. Number 2, they each have individual interests and passions. Do your research. Learn the individual interest and passion of your physicians. You can do this in a variety of ways, such as researching their CVs or their website, as well as engaging their peers and or other stakeholders in the hospital that you might already have a relationship with. Once you have done your research, it is time to build the relationship. So if your physician has an MBA and is an early adopter to new products, think new technology review or maybe committee chair. If your physician is active in clinical societies and they enjoy data, think data review, data analysis, or clinical evidence reviews. At the end of the day, it is important to realize that you have to be able to tie the interest and passion of your physicians with the hospital activity or opportunity that you can ultimately bridge the gap and build a relationship with your physicians. Number 3, they are very data-driven. Physicians will act on objective data and evidence, but you have to know everything about that data and evidence before you present it to them. So, what's the source of the data? How accurate is the data? Ultimately remembering, measure twice and cut once. Using clinical evidence and data to have conversations with physicians will help you build relationships and ultimately create a better conversation. Number 4, they don't understand supply chain as much as you think they do. When it comes to supply chain, you're the expert. And remembering that it's your job to educate them and keep them up to date on what's going on in the marketplace and what's going on at your facility. So be confident in your knowledge and understand that every interaction that you have with your physician is another opportunity to build the relationship. And number 5, they must be engaged early and often. Physicians will be there when you need them if you are proactive when reaching out and understanding that building a relationship first is important before ever asking them to help out in some sort of supply cost initiative. Always remember to reach out first, build a relationship, and then when you do need something from the physician, it will be natural and not forced. Where and when you engage your physicians is just as important, because when physicians walk into the operating room, their personalities change. The operating room is the physician's office, and they are in charge. So let's not choose the operating room to talk about supply chain costs. Choose a neutral setting, maybe a conference room or the cafeteria, somewhere where they can let their guard down and have an objective conversation. So remember, focus on quick wins, track the impact, and celebrate their involvement. And those are the 5 things you need to know.